Hello, I am Chris Shorter, your county executive, and this is Shorter Topics. Thank you so much for joining us today. We are here with Lisa Madron, our Director of Community Services, and also our Chief Transformation Officer. Shorter Topics is all about leadership and meeting leaders from around this community who are doing absolutely phenomenal work. And we are in for a treat today. Lisa, welcome to Shorter Topics.
Thank you. It's a pleasure to be here. Thank you for having me.
Now, recently in this community, we had a pretty big deal ribbon cutting. The CRC, all of our community came out. So many of our elected officials, other partners came out to celebrate what has been quite a journey for Prince William County, one that you have played a very big role in terms of your support. We cut the ribbon on the CRC, and we are very grateful for what is coming in terms of services here. Wondered if we could really spend some time focused on the Crisis Receiving Center, mental health, what it means for this community. I know some who are listening in have some understanding of what the CRC is. Wondering for those who maybe don't, if you could just talk a little bit about what the Crisis Receiving Center is.
Absolutely.
Yeah.
One of my favorite topics
Mm.
is um, the Crisis Receiving Center complex, which has really been a vision change for our community. We're calling it a new dawn in behavioral health for our community and our region.
I appreciate that so much.
And we've really looked at it as providing a very welcoming and safe space for individuals experiencing a mental health or substance abuse crisis,
Mm,
and a place where they can come and receive compassion and dignity and expert care.
mm,
And our vendor that's operating our crisis receiving centers, we have one for adults and one for youth, is Connections Health Solutions.
absolutely.
And we've co-located community services programs to be able to really have a network of care for our individuals.
Mm,
So if they're in crisis and are leaving, we can have a warm handoff to connect them perhaps with community services programs
mm.
that they can benefit from, or Connections will connect them to community resources.
I appreciate that you started with the partner that is sort of going to be providing in terms of the services, the direct services in the CRC started with Connections. They've been a great partner. I will also say you in particular, certainly all of our elected officials, our delegation, our governor's office, so many of the staff here and leaders here have played a big part in making this happen. So just I want to acknowledge and maybe give you a minute or two to acknowledge just some of the just folks who have been involved, including our board, Vice Chair Andrea Bailey, and many on the board who have just really gone above and beyond to make this happen right here in Prince William County.
Yes, thank you. It has truly been one of the best collaborations across state, county, and community
Mm,
for this effort. I think everyone really sees the importance and the impact that this will have on our community. And certainly with our board, who has supported this and provided the first funding for us to really start to launch out.
mm,
Um, Definitely Champion Bailey, who has carried
mhm.
this in her heart this whole time and has really worked across state and various community groups to make this a reality. The state, who has provided a substantial part of the funding,
Mm,
particularly for us to be able to bring on the youth program
mm.
in close proximity to the adult program. And our community folks who have championed this voice, and NAMI and Potomac Health Foundation and Lions, who actually provided some funding with this.
Sure.
The hospital systems, Centera and UVA, have also, UVA Hospital Health have also been great partners
Mm.
around this. We've just had an outpouring of support.
I appreciate that very much. And just in what you've said, you could, I mean, various sectors of our community, public, private, nonprofit, everyone coming together to support this
Absolutely.
effort.
Trillium Center is also a
Yeah.
good
I'm
support.
sure you could probably go on and on
Definitely. I
and
don't wanna forget anybody
on.
because everybody's been so good about it.
So the model. So when I think about today, what we do when someone is experiencing a crisis at home or in some public space, what happens now and what will happen once the CRC is fully open?
So, lots of different possibilities, but what is most typical is, if someone is in the community and having a, behavioral health crisis, mental health, substance abuse, and if the family would call 911 or, if now 988 can connect to some mobile crisis, and so they may come out and help the person. But in many cases, what happens is a person's either brought to the emergency room
Mm,
for assessment and treatment, or comes into contact with the police, and the police will take them to the emergency room. And often they spend hours and sometimes days
mm,
in the hospital in handcuffs waiting for a hospital bed.
absolutely.
And what we've experienced in Prince William in particular is they can't even find a bed within our county or our region. So sometimes they're driven, if a bed is found, after waiting 4 days, to an inpatient bed outside of our region. We have the highest rate of that within our region.
Mm,
They're not necessarily close to family, and when they're ready for discharge, they may not be connected, to community resources, or they're given a number to call and try to figure it out.
which is oftentimes it drops.
Definitely, they may not follow through.
Mm,
They still not may not be stabilized
sure.
when they come out, and for many of them, they don't wanna do that again because it wasn't a very helpful experience. It certainly wasn't human-centered, and it wasn't compassionate in many cases.
Mm,
In some cases, these individuals, because they've been waiting so long, they escalate,
mm,
and they end up doing things that get them transferred perhaps to the adult detention center or jail, which is also not a compassionate reaction to what they're experiencing.
absolutely.
So, what we're hoping with this new complex is, first of all, when they're starting to feel as though they're in crisis, they can walk in. They can walk in to the CRC and talk about their crisis immediately. Or if they're brought in, the police don't have to stay. They can connect the person with a trained clinician
Mm.
team at the
Which
CRC.
puts more of our police officers back
Yes.
into duty and not sitting in an emergency room for hours and sometimes days. Yep.
Exactly. Exactly. The other thing that often took up a lot of time in the community is before a hospital would accept someone, they would ask for medical clearance, which could take a very long time.
Mm,
That is not something that has to happen before the person goes to the crisis receiving center.
that's great.
They have a team of medical professionals that can assess for that if that's needed. They can start the intervention immediately with the person if that's what they need. In some cases, it may just be a connection to a community resource, setting up that appointment so the person doesn't have to stay and can have the appointment in the community and they're set.
Yeah.
For others, the program and the model, they can stay up to 23 hours or through 23 hours at the crisis receiving center getting the intervention. Now, it is a locked facility, but it accepts people that are voluntary and involuntary, and they have a team that is working with the individuals and their families.
This is fantastic. The difference between this model and what some other jurisdictions have done, maybe even outside of the Commonwealth, I wonder if you could just talk a little bit about what differentiates the model that we are instituting here in Prince William County with the CRC.
Definitely,
Yeah.
because they're called CRCs,
Mm.
and not every CRC
Operates
is
the same.
the same.
Yeah.
And absolutely what's happened in the other state and what they've brought on, either 23-hour units or crisis stabilization units, are vital for our system of care. They are needed. But it's not the same. They don't have them often co-located, and it's not necessarily the model. So someone, for example, may be under a temporary detention order, and they may go to a crisis stabilization unit or a CRC someplace else,
Mm,
and they're going to be there overnight for a few days. With our model, if you start where the individual is, even if they're under that, they may not need that full care for several days.
mm.
So they start in the least restrictive. They start with the 23 hours to see what's going on, what do they need, and they may be able to be stabilized and discharged sooner and connected to care.
So, if you will, just I know there is so much happening around mental health, not just here in Prince William County, really. This is a national conversation that's happening around mental health, behavioral health. I wonder if you could just talk a little bit about the stigma associated with getting treatment, getting services, having the conversation in our homes, with our families, in our community, not just again here, but nationally.
Yes, while I'd say in some respects the stigma around mental health issues has gotten somewhat better in that people are more verbal about it,
Mm,
there is still stigma. And that is one of my hopes with respect to the Crisis Receiving Center complex, that this facility and the treatment and services offered will really be seen as changing that stigma,
mm,
that this welcoming quality service, compassionate care place will demonstrate that any of us
yes.
over the course of our lifetime can experience a mental health crisis, a behavioral health issue, and that we deserve compassionate and expert care, which this complex hopefully will offer.
Yeah, and hopefully bring down some of the remaining stigma associated with seeking help, where
Absolutely.
help is needed. So you all, when I say you all, the viewers, listeners, could certainly tell why we are so excited here in this community to finally, after all this time, be able to say that we have a CRC that's about to be operational, and certainly to be able to thank you on camera and for the listening ear for all of your leadership around the CRC and getting it introduced to this community. Now, at the same time that this is happening, you're also serving as our county's chief transformation officer. And working tirelessly on all of the kind of transformation projects happening within the county. I wonder if you could talk just a little bit about sort of kind of what brought you into public service and maybe end with kind of this transformation work and what this has meant over the last 2 years.
Certainly.
Mm,
It's been a journey into public service, I
sure.
think, for me over the years with experience in the private, for profit, nonprofit sectors.
Mhm.
And each role has been invaluable to my learning and experience, but public service really is where I found my purpose.
Mm,
I've always been interested in serving, and the clinical aspects have fascinated me, as well as communities and organizations dealing with systems, trying to streamline systems, trying to remove barriers, which also ignited my interest in transformation,
mm,
helping to have different perspectives, different ways of seeing things. And that's really, I think, one of the things that we've done with the Crisis Receiving Center. It's a new way of seeing and doing behavioral health rather than, do you meet this criteria? It's, welcome, let's start where you are,
right.
which is a flip.
Absolutely. Absolutely.
And the transformation projects and being able to see in the county and help with those challenges. And one thing I'm good at is persevering. So
Mhm.
we've been continuing to
Absolutely, you sure are, and it has been quite a journey in terms of just the transformation work and creating the office, having you as our first transformation officer, and then the team that you've created, just phenomenal
team's
work.
fantastic.
Uh, and we are now at this point as an organization where we're transitioning from one transformation officer to another in the next 30, maybe 60 days. And so this has been quite an experience, just not just for the organization, but I'm sure for you as a leader as well.
It has. It's been, fantastic, and I will definitely take some key learnings back to CS. The Definitely wanna thank the TMO team that is filled with talent and has really made, an impact, I think, across, departments and
Yeah.
counties, and we've, dealt with everything from strategic initiatives and process improvements, business redesigns to leadership development,
Absolutely.
and have
Supporting agencies across
yes,
the organization
uh,
with training, with professional development, with retreats, with
absolutely.
supporting the strategic planning process in so many ways. The list really does go on and on. In terms of your journey, though, did you always know that you wanted to come into public service, or was it college? Was it graduate school? What sent you on this path? Uh,
I actually was pre-med in college. I wanted to go into medicine. And I did a practicum at a domestic violence shelter and recognized that they had a lot of programs for the women that were leaving the shelter and coming back, but they had nothing for children. And so I started a children's program, and that's, I think, what kicked it off.
mm,
I started really wanting to work with those that had been trauma survivors and got into a lot of different areas to work with that. And I think always wanting to kind of make the system better if I could. And just, I think the other thing I've discovered with public service is that it is really a mission of a vocation.
yeah.
And I'm so inspired by the people that have chosen that path.
So I did not realize that the journey started there. But when I think about now, it's full circle what you have in your leadership uh, done in the county, where not just adults, but young people will be treated at the CRC. Uh, Phenomenal.
That's why I'm so excited about the youth component because
Yeah.
we really we could always use more services across the board, but especially for youth. We will have a youth program
Mm.
to really address some of the key issues for youth that we haven't had.
So we haven't talked a lot about just the community services portfolio of support generally. I know we probably don't have time today, given the focus on the CRC. I wonder if you could just give us a little bit on where folks could go just to find out more about the CRC, about community services generally, and the support you all provide.
Absolutely. Definitely the community services website for Prince William County will provide information on the programs and how to access community services programs at our different sites. The Worth Avenue is one of the sites. We have a Sedley North site and a Ferlazzo site
Mm,
that continues to offer programs. And we will have information on our CS site on the Crisis Receiving Center complex
mm.
and when licensing has approved so that we can move towards opening at our Worth Avenue site.
Could probably talk forever about this. But this is shorter topics and we want to sort of keep it short. Thank you so much for being here,
Thank you.
for the leadership, for all that you have done for this community, not just over the last few years, but over the last career, I should say, the time that you spent here in the county. Certainly, this last few years that I've been here as a county executive, I've seen your leadership firsthand, not just with the CRC, but with the Transformation Office as well. So thanks, 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 thanks.
Thank you. And thank you for the opportunity to be
Absolutely.
able to do this.
And thank you all for tuning in. Shorter topics, bigger impact. We will see you next time.